And breaking news, President Trump signing an executive order calling for an update on childhood vaccine recommendations. That order recommending that children get shots to help protect against 11 diseases, down from 18. It also splits up the measles and mumps and rubella vaccine into 3 separate shots. A move public health experts warn could lead to an increased risk of children becoming infected with the vaccine, preventable disease before returning for another visit. Here's the president just moments ago.
You have the MMR. We want it in 3 separate vaccinations, given at separate times. Together, there could be a possibility they're quite lethal, and separately, it looks like they are not at all lethal, but just very effective. So the MMR, we want to have separate visits, separate times. The vaccine being broken into 3 separate single doses, and vaccines being administered in separate visits.
All right, for more, let's bring in our medical correspondent, Dr. Darian Sutton. So, as a medical professional, Doc, what's your reaction to this executive order?
Extreme concern, Kira. When misinformation is shared about vaccinations, it translates to parents not getting their children vaccinated against diseases that are preventable, and then leads those children to coming into the hospital requiring treatment. It is so important to understand the actual data and the actual evidence and the truth about vaccinations. MMR vaccinations have not had any documented association to a death in healthy people, and that is verified by the Infectious Disease Society of America. When you ask the main question, which is what parents want to know, which is what is safer? Should I separate my vaccinations or should I combine them? The main question here is safety, and that requires evidence. And as a physician, the next step is to provide that information from the best places that we know. For example, the American Academy of Pediatrics has stated that giving routine vaccinations simultaneously is safe and effective, and the adverse events as well as the negative side effects essentially from these vaccinations is comparable to giving them separately. So that inherently helps you to understand that giving a vaccination separately does not provide additional benefit to a patient, does not provide additional safety to a patient, and in many cases it may make it more difficult to reach that routine vaccination status so that you can cover a child completely. This is so important to understand as we move into a year where we're seeing the highest number of cases of measles that we've seen in the United States in over 35 years, as the rate of vaccinations among children continues to decline in the United States. More than 280,000 children are currently in kindergarten, not up to date on their vaccinations. And when we compare vaccinations and actual disease, the choice is quite obvious. When you look at the outcomes of these vaccinations, although no vaccine is risk-free, you still have exceedingly rare risks associated with vaccinations. Approximately 30% of cases of measles will develop a complication. I've seen some of them. I've treated patients throughout our measles outbreak here in New York City during the height of that measles outbreak, and I understand very well how misinformation translates to lack of protection, which leads to children becoming patients.
So the CDC typically provides recommendations as to which vaccines to receive and at what age. I mean, I remember going through this with my kids. So this often guides health insurance coverage as well. So how could an executive order impact all of that?
That's yet to be told. Right now, we do understand that federal guidelines mandate that many health insurers cover vaccinations that have been recommended by the ACIP, the Academy, basically I'm missing the word now, but it's the group of people who decides whether or not we should get vaccinations and makes those recommendations, essentially. We've been focusing on that topic a lot, and we want to make sure that we understand so that we can provide that information to parents and patients. What is important to understand here, however, is that there is a risk that if there was a change to ACIP, the Committee on Immunization Practices, I lost it initially, but now I've gotten it back. If there's a change on that status of the Committee of Immunization Practices, it may lead to decreases or difficulty in making sure that you have these vaccines covered. That leads to a financial difficulty with parents having to figure out how to pay for these vaccinations, and also with providers in rural towns that have difficulty storing these vaccines. A lot of that requires funding and support, and these approvals can translate, unfortunately, to more children being left without protection.
Got it. And you know, you have so many acronyms to remember. I had to look up ACIP. So, not everyone can be perfect here when you're handling so many different stories and very complex stories. You're amazing, Dr. Darian Sutton. Thank you so much.
Thank you.